And very good evening. Today I will be talking about how health communication through social media is really effective. So as we all know, social media used for communication purpose in health context for is increasing and become more acceptable. So the users of social media for health communication can include public, patient, health professional, and health organization. And in this generation, they are expecting to get knowledge, information, and details through internet. And social media is one of the platform. Therefore, I will be presenting 3 reasons to support my opinion, which is social media is effective for health care communication. So 3 reasons that I will be talking about is first about the general awareness and medical information. Second, it is about crisis situation, and last but not least is about peer supports. So moving on to my first point, which is general awareness and medical information. So basically through internet, they could diagnose themselves and seek help, because in the internet they already provided information. So basically those person who want to know about their health situation, they could browse through the internet. Even though there's information that it is not authentic, at least the people who care about their health could take a prevention before it is too late. And moving on, by broadcasting the fact-based and applicable information, so basically the health organization could upgrade and improve the well-being of the public health. And through social media, they could search information about the doctor or hospital and the specialist, and also not to forget that previous patient could review their or give feedback about their experience and of the services. So the next person who are looking for the services could choose which is the best provider and care location. So I've talked about general awareness and medical information. Moving on to my next point, which is crisis situation. It is proven that social media is an effective tool for distributing information instantly to the people through the social media. For example, in Japan, 2011, Twitter has been used to update how much ill patients are there. And in 2009, US Disease Control and Prevention has used social media to educate people about the H1N1 virus. Therefore, we could say that how important social media for the healthcare communication. It provides. Not to forget that from the social media we could update how much hospital capacity, how the operation status, and last but not least about the room as emergency room access. So it is vital. Through social media we could build the awareness and preventive knowledge among the health practitioner and public, so they could they could know better, and through social media also they could reduce the spread of misinformation about prevention or risk factor and the treatment. That's all for my second point, which is crisis situation. Last but not least is about peer support. As we all know that people who are in having health problem, they went through some hard time and difficult time, but through the social media, they just knowing that someone out there is having the same problem with them and have made it. I mean, they could go through the disease that they are having, they face their problem, so it will provide emotional support for the patient through the social media. Social media based on research, social media show that it shows positive health outcome, because like when people giving a compliance through the patient, their health status getting better. And not to forget that social media offer forums for other people, public patient, to ask their question or to share their view or clarify their doubts, so that professional health practitioner or professional health practitioner or peer could answer their question or doubts. In addition, there's a lot of campaign have been spread. I mean, the campaign have been done through social media. For example, for smoking cessation and weight loss journey that motivate others people to choose a better lifestyle. Plus, organ donation and funding also being distributed or spread through social media, which this help a lot for those people who searching for organ, and for those who doesn't have enough money to support their hospital bill. So in my conclusion, what I could say is that regardless of the size of healthcare organization, it is time to adopt appropriate guideline for the user of social media in healthcare communication to address challenges and growing expectation of using social media, especially within healthcare context. And the key point here, the key message is that social media has the potential to replace other methods, but not replace, the key message is that social media has the potential to supplement and complement, but not replace other methods to improve communication and interaction among members of the general public, patient, health professional, and health organization. That's all from me. Thank you.